The surgical glove snapped against her wrist, double-layered, pulled tight enough to erase every wrinkle. Dr. Claire Watts adjusted the fit without looking, fingers working by memory alone. She'd done this thousands of times. The ritual never changed. Around her, the VA Medical Center's trauma bay hummed with the usual morning chaos. Monitors beeped in overlapping rhythms. Nurses called out medication orders. Someone laughed, too loud, near the coffee station. Claire kept her head down, reviewing charts on the tablet in front of her. "You're the new attending?" She looked up. Dr. Victor Brennan stood 3 feet away, arms crossed, white coat spotless. 52 years old, Navy flight surgeon patch still sewn on his shoulder despite retiring a decade ago. Chief of Trauma Surgery, her boss. "Dr. Watts," she said, "started 2 months ago. I know who you are." His eyes moved to her hands. "You always wear those?" "Surgical gloves, yes. Even now, we're not in the OR. I prefer them." Brennan's mouth twitched. Not quite a smile, not quite a sneer. "Germaphobe?" "Something like that." He stepped closer, scanning her badge, her posture, the way she held the tablet against her chest like a shield. "Your file says you finished residency at County General. 3 years in emergency medicine before trauma fellowship." "That's correct. No military background." It wasn't a question, but the pause hung there anyway. "No," Claire said. "Interesting." Brennan tapped his own tablet. "Because Nurse Kellerman swears you use battlefield triage instincts. Says you move like someone who's seen combat." "I study efficiently." "Right." He didn't believe her. "Well, Dr. Watts, let's see how efficient you are. Trauma incoming. Motorcycle versus semi-truck. Male, mid-30s, GCS of 8, hypotensive. Yours." He walked away before she could respond. Claire exhaled slowly, pulling her gloves tighter. Across the bay, Tom Kellerman, 45, former Army medic, too observant for his own good, caught her eye. He nodded once. She nodded back. The doors burst open. Paramedics rolled in fast, shouting vitals. BP 70/40, heart rate 130, decreased breath sounds on the left. Claire moved. Her hands were already reaching for the stethoscope around her neck as she closed the distance. No hesitation, no wasted motion. "Trauma 2, she said. "Get me a chest tube kit and 2 units of O-negative." The paramedics transferred the patient. Male, 34, leather jacket shredded, left leg bent wrong. His face was pale, lips tinged blue. Claire pressed the stethoscope to his chest. Silence on the left side. "Pneumothorax," she said. "Tension. He's not moving air." One of the residents, Priya Chandran, 29, sharp-eyed and skeptical of everyone, leaned in. "You sure? The X-ray isn't back yet." "Look at his neck veins. Tracheal deviation. He doesn't have time for imaging." Priya hesitated, then stepped back. Claire grabbed the chest tube kit Tom had already placed on the tray. Her gloved hands moved fast. Betadine swab, local anesthetic, scalpel. The incision opened clean between the 4th and 5th ribs. She didn't flinch, didn't pause. The Kelly clamp slid through the intercostal muscle, spreading the tissue. Then the tube, smooth, controlled, one motion. Air hissed out. The patient gasped. His oxygen saturation climbed. 78, 82, 90. Tom checked the monitor. Pressure's coming up. 90/50. Claire secured the tube with sutures, hands steady despite the double-layer gloves making fine motor control harder. The stitches were precise, evenly spaced, almost mechanical. Pia stared. "How did you know without imaging?" "Physical exam." Claire stripped off her gloves, immediately pulling on a fresh pair from her pocket. "Get him to CT. Check for internal bleeding." She turned to leave. Brennan was standing in the doorway. "Fast," he said. "He'll be fine." "I didn't say that was a compliment." Claire met his eyes. "Is there something else?" "Yeah." He stepped closer, voice dropping. "Nobody moves like that 2 months into attending life. Nobody picks up tension pneumothorax that fast without imaging. And nobody," his gaze dropped to her hands, "wears gloves like they're hiding something." She didn't answer. "Where'd you really train, Dr. Watts?" "County General." "Bullshit." The word landed hard, but Claire's expression didn't change. Behind them, Tom cleared his throat. "Dr. Brennan, radiology's asking about the incoming CT." "Not now, Kellerman." Tom didn't move. Brennan's jaw tightened. He looked back at Claire. "I'm going to figure you out. Good luck." He left. Claire waited until his footsteps faded, then turned back to the trauma bay. Her hands were shaking, just slightly. just enough that she had to clench them into fists inside the gloves. Tom stepped beside her. Quiet, careful. You okay? Fine. That wasn't a lucky guess, Doc. She glanced at him. What are you saying? I'm saying I've seen that kind of speed before. Iraq. Medics working in the back of Humvees under fire. He paused. You move like someone who's done this when it really mattered. Claire's throat tightened. I did my job, she said. That's all. Yeah. Tom's voice softened. That's what we all say. She didn't respond. Across the room, Priya was still watching. Curious now, not suspicious. The patient was stable, monitors steady, the crisis already fading into routine. But Claire could feel it. The weight of the gloves, the texture of the scars underneath, the memories that never quite stayed buried. She pulled the gloves tighter. Her hands didn't shake anymore. For more stories like this, subscribe. The residence lounge smelled like burnt coffee and disinfectant. Priya sat on the torn couch, scrolling through her phone, while two other residents huddled near the vending machine. Did you see Watts with that pneumothorax? One of them said. She didn't even wait for imaging. Lucky guess, the other replied. Brennan's going to tear her apart if she's wrong one of these days. Priya looked up. She wasn't wrong. This time. Every time. Priya set her phone down. 3 weeks ago, she diagnosed a ruptured spleen before the ultrasound confirmed it. Last week, she called an aortic dissection from the guy's voice alone, said he sounded air-hungry. What does that even mean? The first resident shrugged. Maybe she's been studying surgical videos all night. YouTube has everything now. Nobody learns to suture like that from videos. They went quiet. Priya stood, grabbed her coffee, and left. In the hallway, she found Tom restocking a crash cart. He worked methodically, checking each drawer, making sure the medications were in order. Kellerman. He glanced up. Dr. Chandran. What do you know about Watts? Tom's hands paused for half a second, then resumed. She's a good surgeon. That's not what I asked. Then maybe you're asking the wrong question. Priya stepped closer, lowering her voice. You said something earlier. About Iraq. About her moving like a combat medic. I said she moves efficiently. Bullshit. Tom smiled faintly. You're learning from Brennan. I'm serious. He closed the drawer, locked the cart, and turned to face her fully. Look, Dr. Chandran, I've worked with a lot of doctors, civilians, military, everything in between. Most of them are good. Some are great. But there's a difference between someone who learned trauma surgery in a controlled OR and someone who learned it when the lights went out and the mortars were still falling. You think she's military? I think she's someone who's seen things she doesn't talk about. He pushed the cart past her. And I think that's her business. Priya watched him go, then pulled out her phone. She opened the hospital directory, found Claire's profile. Education, County General, Residency, Standard 3 years, Fellowship, Trauma. No gaps, no military service listed. But something didn't add up. She pocketed the phone and headed back to the trauma bay. Claire was at the nurse's station, finishing her notes from the motorcycle case. Her hands moved across the tablet screen, gloves still on. Still double-layered. Brennan appeared behind her like a shadow. Dr. Watts. She didn't look up. Dr. Brennan. That chest tube, you didn't follow protocol. The protocol would have killed him. The protocol, Brennan said slowly, is there for a reason. Imaging first, confirmation, then intervention. He had tracheal deviation and distended neck veins. Waiting would have caused cardiac arrest. You don't know that. Now she looked up. Yes, I do. Brennan's jaw tightened. You're still on probation here, Dr. Watts. 2 months doesn't make you indispensable. It makes you replaceable. Claire held his gaze. Is there a patient that needs my attention? Not yet. He leaned against the counter. But when there is, you wait for imaging. You wait for confirmation. You follow the chain of command. Understood? Understood. He walked away. Priya, standing a few feet down the hall, had heard everything. She approached cautiously. He's wrong, you know. Claire saved her notes, locked the tablet. He's the chief. That doesn't make him right. It makes him in charge. Priya hesitated. Where'd you really learn to work that fast? Claire's hands stilled on the tablet. I study hard. That's what you keep saying. Because it's true. Before Priya could push further, the overhead speaker crackled. Trauma alert. Inbound. ETA 3 minutes. Industrial accident. Nail. Late 20s. Crush injury to the chest. Possible flail chest. Hypotensive and unresponsive. Claire moved immediately. Priya followed. The trauma bay filled fast. Nurses prepped the bed. Tom rolled in the airway cart. Brennan arrived last. Pooh. When Watts runs in, Claire, "You're observing on this one." Claire stopped. "Observing? You heard me." "Sir, I'm scheduled to follow my orders." He turned to Priya. "Dr. Chandran, you're primary." Priya's eyes widened. "Me? Problem?" "No, sir." The doors exploded open. Paramedics rushed in, rattling off vitals. 28-year-old male, forklift rolled onto his chest, sternum's unstable, BP 60/30, oxygen sat 72. They transferred him. The man's chest moved wrong, sections rising while others fell. Paradoxical breathing, flail chest. Priya stepped forward, hands shaking slightly. "Get me a chest x-ray and—" "No time," Claire said from the side. Brennan shot her a look. "Dr. Watts, you're observing. His chest is moving independently. He's got at least 4 rib fractures, flail segment. If we wait for imaging, he'll go into respiratory failure. Dr. Chandran is capable." She's hesitating. Priya flushed but didn't argue. Brennan stepped closer to Claire. "You don't get to override me." "I'm not overriding, I'm advising. You're out of line." The patient's oxygen dropped. 68, 64. Tom looked at the monitor, then at Brennan. "Sir, he's desaturating fast." Brennan stared at Claire. She stared back. Finally, he turned to Priya. "Intubate him, now." Priya grabbed the laryngoscope, but her hands fumbled. The patient thrashed weakly, airway collapsing. "I can't, there's too much blood." Claire moved. She crossed the space in 2 steps, took the laryngoscope, tilted the patient's head, and slid the tube in one smooth motion. No hesitation, no second attempt. The ventilator kicked in. Oxygen climbed. 70, 76, 82. The room went silent. Brennan's face turned red. "I told you to observe. He was dying. That's not your call." "Then whose call is it?" Claire's voice stayed level, but something sharp edged into it. "Yours, while you stand there deciding whether protocol matters more than a pulse." No one moved. Brennan took a step forward. "My office, now. The patient needs— Kellerman can handle it. My office." Claire pulled off her gloves, replacing them immediately with a fresh pair from her pocket, and followed Brennan out. Priya stood frozen, staring at the patient. Stable now, breathing evenly, alive. Tom checked the monitors, then glanced at her. "You okay, Doc?" "She just saved his life." "Yeah, and Brennan's going to destroy her for it." Tom didn't answer. In the hallway, Priya heard raised voices from Brennan's office. She couldn't make out the words, but the tone was clear. She pulled out her phone again, opened a search engine, and typed, "Military trauma surgeons, female, discharge records." The results loaded slowly, but she kept scrolling. Brennan's office was small, neat, and lined with framed commendations. Navy flight surgeon certificates. A photo of him shaking hands with an admiral. Everything positioned to remind visitors who was in charge. Claire stood in front of his desk, hands clasped behind her back, gloves still on. "You violated a direct order," Brennan said. "I saved a life. You undermined my authority in front of my staff. Your authority was about to cost a man his airway." Brennan slammed his hand on the desk. "You don't get to make that judgment. You're a junior attending. You've been here 2 months. 2 months. And you think you know better than me?" Claire didn't flinch. In that moment, yes. "Then maybe you don't belong here." The words hung in the air. Claire's jaw tightened, but her voice stayed calm. "If that's your decision, I'll clear my locker. Don't tempt me." She met his eyes. "I'm not trying to challenge you, Dr. Brennan. I'm trying to do my job. Your job is to follow protocol. My job is to keep people alive." Brennan leaned back in his chair, studying her. "You're hiding something." Claire's hands shifted slightly behind her back. "I don't know what you mean. Those gloves, that speed, the way you move like you've done this 1,000 times under worse conditions." He paused. "Who are you really?" "I'm a trauma surgeon." "Bullshit." Claire took a breath. "Are we finished here?" Brennan stared at her for a long moment, then waved toward the door. "Get out, but I'm watching you, Watts. One more stunt like that and you're gone." She turned and left. In the hallway, her hands were shaking again. She pressed them flat against her sides, willing the tremor to stop. The scars underneath the gloves ached. Phantom pain, the doctors had called it. Nerve damage that never fully healed. She'd learned to work through it, but days like this made it worse. Tom was waiting near the elevator. "How bad?" he asked. "I still have a job, for now." Claire nodded. "For now." They rode the elevator down in silence. When the doors opened on the ground floor, the overhead speakers cracked. CLED again. All personnel, mass casualty drill in 30 minutes. Report to your assigned stations. Tom groaned. I forgot about this. Drill? Claire asked. Every quarter. Brennan's idea. Simulates a multi-vehicle accident with 10 casualties. Tests our response time, triage, coordination. He glanced at her. You'll be expected to participate. Where do I go? Trauma bay. You'll be sorting the mock patients. He paused. It's all fake. Actors with makeup. Don't take it too seriously. But Claire's expression had already shifted. Something in her eyes went distant, focused. Tom noticed. Doc, I'm fine, she said. I'll be there. 30 minutes later, the trauma bay was chaos. Actors lay on gurneys, covered in fake blood, groaning dramatically. Some had tags indicating their injuries, sucking chest wound, traumatic amputation, internal bleeding. Residents ran between them, shouting orders, trying to prioritize. Brennan stood in the corner with a clipboard, timing everything. Claire entered quietly, scanning the room. Her mind shifted instantly into triage mode. She moved between the gurneys, assessing each patient in seconds. Her hands hovered over injuries, checking pulses, noting breathing patterns. She didn't speak, didn't shout, just moved. Within 2 minutes, she'd reorganized the entire bay. This one first, she said, pointing to a patient tagged with tension pneumothorax. Then him, a sucking chest wound. Then her. Femoral artery bleed. Priya, standing nearby, blinked. How did you? Triage is about time, not severity, Claire said. Save the ones you can save fastest, then move to the next. But the protocol says, the protocol assumes you have unlimited resources. Claire's voice was calm, clinical. You don't. You never do. She kept moving. One of the residents tried to intubate a mock patient and fumbled. Claire stepped in, repositioned the airway mannequin, and demonstrated the correct angle. Her hands moved like they were conducting an orchestra. Precise, fluid, no wasted motion. Tom watched from the supply station. He'd seen this before, not in drills, in real life, in the field. Brennan was watching too. His pen had stopped moving on the clipboard. Claire reached the last patient, an actor with a fake abdominal wound, groaning about pain. She knelt beside the gurney, gloved hands checking the abdomen. Then she paused. Her left glove had caught on the edge of the gurney rail. A small tear opened near the wrist. She pulled her hand back quickly, but not before a flash of scarred skin showed through. Priya saw it. So did Tom. Claire's face didn't change, but her breathing quickened. She stripped off both gloves immediately, pulling a fresh pair from her pocket. Her hands moved fast, almost frantic, covering the exposed skin before anyone else could see. But Priya had already moved closer. Doctor? Watts, I'm fine, Claire said. Your hand? It's nothing. That didn't look like nothing. Claire stood, gloves secured, and faced her. Drop it, Dr. Chandran. Priya hesitated, then nodded. Across the room, Brennan called time. Drills over. Reset the bay. The actors climbed off the gurneys, wiping fake blood from their arms. Residents dispersed, talking in low voices about their performance. Brennan approached Claire. That was fast, he said. Thank you. I didn't say it was good. Claire waited. You reorganized the entire triage system in under 3 minutes, Brennan continued. That's not standard training. That's battlefield instinct. I studied. Don't. His voice dropped. I've been doing this for 20 years, Watts. I know what combat triage looks like, and I know what it sounds like when someone's lying to me. Claire's jaw tightened. I've never served in combat. Then where did you learn that? She didn't answer. Brennan stepped closer. I'm going to pull your file. Every piece of it. And when I find out what you're hiding, you're finished here. He walked away. Tom approached from the side. You okay? Fine. Your glove tore. Claire looked at him. You saw. Yeah. And? Tom's expression softened. And I'm not going to say anything. But Priya's curious, and Brennan's suspicious. You can't keep this hidden forever, Doc. I can try. He nodded slowly. Yeah, I guess you can. Claire pulled off her gloves again. Habit now, reflex, and replaced them with a fresh pair. Her hands had stopped shaking, but the ache in her scars remained. She glanced at the trauma bay doors, where ambulances came and went, where real emergencies replaced fake ones, where the past was always one patient away from surfacing. Tom watched her. What are you really afraid of? Claire didn't answer, but her hands tightened inside the gloves, and for just a moment, she looked like someone carrying a weight too heavy to name. Then she turned and walked back to the nurse's station, and the moment passed. Tom stayed where he was, arms crossed, thinking about the scars he'd glimpsed, thinking about the way she moved, thinking about the things people hide when the truth is too dangerous to tell. The call came at 2:47 p.m. on a Tuesday. Claire was reviewing lab results when the overhead speakers erupted. Trauma alert, inbound, ETA 4 minutes, motor vehicle collision, single occupant, male, early 60s, unresponsive at scene, GCS 3, hypotensive, possible internal injuries. She stood, already moving toward the trauma bay. Tom was pulling on a gown. Priya grabbed gloves from the dispenser. 2 other nurses prepped the bed, laying out instrument trays. Brennan arrived, scanning the room. His eyes landed on Claire. "Watts, you're secondary on this one." "Understood." "I mean it. Hands off unless I tell you otherwise." Claire nodded, stepping back to the edge of the bay. The doors burst open. Paramedics rushed in, their voices overlapping. 61-year-old male. Head-on collision with a guardrail. Steering wheel impact to the chest. BP 70/40, heart rate 110, decreased breath sounds bilaterally. They transferred the patient. Claire's breath stopped. She knew that face. Older now. Gray hair instead of black. Lines around the eyes. But the bone structure was the same. The jaw. The small scar above the left eyebrow from an old shrapnel wound. Lieutenant General Marcus Hayworth. Retired now, clearly. Civilian clothes. No uniform. But she'd know him anywhere. The man who signed her court-martial papers. The man who destroyed her career. Her hands clenched inside the gloves. Brennan was already working, checking pupils, palpating the abdomen. Pupils sluggish but reactive, abdomens rigid. "Get me a fast exam and 2 units of O negative." Tom moved in with the ultrasound probe, scanning quickly. Free fluid in Morrison's pouch, likely liver laceration. Damn. Brennan straightened. He needs surgery now. Prep OR2. Claire didn't move, couldn't move. Her mind was back in Helmand Province, back in the field hospital, back in the fire. Priya noticed. "Dr. Watts?" Claire blinked, forcing herself back to the present. "I'm fine." "You don't look fine." "I said I'm fine." Brennan glanced over. "Watts, if you're not up for this, I'm up for it." But her voice sounded distant, even to herself. They rolled Hayworth toward the elevator. Brennan followed, barking orders. Priya went with them. Tom stayed behind to clean the bay. Claire stood frozen in place. Tom approached slowly. "You know him." It wasn't a question. Claire's throat was tight. "No. Doc, I don't know him." Tom studied her face, then nodded. "Okay." He didn't believe her. Claire pulled off her gloves, replaced them, pulled them tighter. Her hands were shaking again. Worse this time. The scars underneath felt like they were burning. She closed her eyes, forcing herself to breathe. In, out, in, out. The smell of antiseptic mixed with smoke in her memory. The sound of monitors blending with the whistle of incoming mortars. The weight of a surgical gown soaked with blood that wasn't hers. Dr. Watts. She opened her eyes. Dr. Sarah Voss stood in the doorway. 38, cardiothoracic surgeon, the only person at the VA who knew pieces of Claire's past. Not everything, but enough. "You okay?" Sarah asked quietly. "I'm fine." "You're white as a sheet." Claire swallowed. "Who is he?" "The patient?" Sarah glanced toward the elevator. "Marcus Hayworth, retired general. Lives in Boulder now. Volunteers with veteran support groups." She paused. "Why?" Claire didn't answer. Sarah stepped closer, lowering her voice. "Claire, do you know him?" "I need to scrub in." "Brennan said you're secondary. I need to scrub in." Sarah's expression shifted. She'd seen Claire like this once before, when a patient came in with blast injuries that matched a specific IED pattern. Claire had locked herself in a supply closet for 10 minutes afterward. "You can't operate on someone you know personally," Sarah said gently. "That's not just protocol, that's ethics." "I don't know him." "Then why do you look like you've seen a ghost?" Claire met her eyes. "Because maybe I have." Before Sarah could respond, Priya appeared in the hallway, jogging toward them. "Dr. Watts, Dr. Brennan wants you upstairs. Hayworth's bleeding got worse. They need extra hands." Claire's pulse quickened. "I'm coming." Sarah caught her arm. "Claire, I have to go." "Wait." But Claire was already moving. She took the stairs instead of the elevator, needing the movement, needing the burn in her legs to distract from the burn in her hands. By the time she reached the surgical floor, her breathing was ragged. She scrubbed in mechanically, Soap, water, brush. The routine steadied her. Through the window, she could see the OR. Hayworth on the table. Brennan at his side. Priya across from him. Monitors beeping steadily. Claire P. Whoosh through the doors. Brennan looked up. Took you long enough. Get over here. She moved to the table. Hayworth's chest was open. Brennan's hands were inside, pressing gauze against a bleeder. Blood pooled faster than suction could clear it. Liver lack is worse than I thought, Brennan said. Grade 4, maybe 5. I need you on retraction. Claire picked up the retractor, positioning it carefully. Her hands were steady now, training overriding emotion. She stared down at Hayworth's face, unconscious, intubated, vulnerable. For 5 years, she'd imagined what she'd say if she ever saw him again. The accusations, the anger, the demand for answers. Now he was here, and she had nothing but silence. Brennan worked quickly, his hands moving through the abdomen. Priya, more suction. Watts, hold that retractor steady. Claire adjusted her grip. And then Hayworth's left hand slipped off the table, dangling. She saw it clearly. The missing ring finger, the scar tissue around the stump, an old injury. 2003, Fallujah, IED. She knew because she'd read the report. She'd been 19, just enlisted, studying field medicine. Hayworth had been a colonel then, leading medical operations. The story was famous in military medical circles. He'd lost the finger, saving a medic trapped under a Humvee. He'd been a hero. And then, 16 years later, he'd signed the order that labeled her a coward. Watts, I said hold it steady, she snapped back, tightening her grip. Brennan tied off a vessel, then paused, glancing at her. You're quiet. Focused. You're never this quiet. Claire didn't respond. He returned to the surgery, packing the liver, checking for additional bleeders. The minutes stretched. 30, 40, 50. Finally, Brennan stepped back. That's it. Close him up. Priya, you're on sutures. Priya moved in, threading the needle. Claire released the retractor, stepping back. Her hands were aching now, the scars tight under the gloves. Brennan stripped off his gown, tossing it in the bin. Good work. He'll make it. Claire nodded. As she turned to leave, Hayworth's monitor beeped. A normal rhythm, steady, strong. She paused at the door, looking back. He was alive, because of her. The irony was suffocating. Outside the OR, she stripped off her gloves, replaced them, and leaned against the wall. Her pulse was pounding in her ears. Sarah appeared beside her. You okay? No. Who is he, Claire? Claire closed her eyes. The man who ended my career. Sarah went still. What? Helmand Province, 2019. He signed my court-martial. Claire's voice was flat, emotionless, and now I just saved his life. For a long moment, Sarah didn't speak. Then, quietly. What are you going to do? Claire opened her eyes, staring at the OR doors. I don't know. If you want to see what Claire does next, subscribe to Emergency Heroes Stories. Because what happens when Hayworth wakes up will change everything. Claire stood outside the recovery room for 20 minutes before she could bring herself to open the door. Hayworth was still unconscious, intubated, monitors tracking every heartbeat, every breath. His face was pale, but stable. The surgery had been successful. She stepped inside, moving quietly to the foot of the bed. For 5 years, she'd carried the weight of his signature on those papers. The dishonorable discharge, the loss of her commission, the months of appeals that went nowhere, the civilian medical boards that questioned every gap in her resume. Now he was here, helpless, dependent on her skill to survive. She could walk away, let someone else handle his post-op care. Priya was capable. Brennan was thorough. Hayworth would recover fine without her. But that wasn't who she was. Even now, even after everything. She checked his vitals manually, running through the same assessment she'd done 1,000 times. Pulse strong, blood pressure stable, oxygen saturation 98%. The liver repair was holding. Her hands moved over the monitors, adjusting settings, confirming dosages. Then she left. In the hallway, Tom was waiting. You've been standing outside that room for half an hour, he said. I was checking on the patient. For half an hour? Claire didn't answer. Tom crossed his arms. You want to tell me what's going on? No. Fair enough. He paused. But Brennan's asking questions. He pulled Hayworth's military records, saw he was CENTCOM medical operations, started wondering if there's a connection. Claire's stomach dropped. What did you tell him? Nothing, because I don't know anything. Tom's voice softened, but maybe I should. She looked at him, really looked. 45 years old, former Army medic. 2 deployments. He'd seen enough to recognize the signs of someone carrying trauma they couldn't name. Helmand Province, she said quietly. 2019. I was the senior surgeon at a forward field hospital. We took mortar fire during a mass casualty event. Explosion killed 6 of my team. I stayed behind to save the patients. 40 minutes in a burning hospital. She held up her gloved hands. These are the scars I got for it. Tom's expression didn't change, but something in his eyes shifted. And Hayworth? He signed the court-martial, said I violated evacuation protocol, called it insubordination. Her voice stayed level. Clinical. Dishonorable discharge. Lost everything. Jesus. I rebuilt. Civilian credentials. Started from scratch. She glanced back toward the recovery room. And now he's here. Tom was quiet for a long moment. You going to tell Brennan? No. He's going to find out eventually. Maybe. Claire adjusted her gloves. But not today. Before Tom could respond, Priya appeared at the end of the hall, walking fast. Dr. Watts, Brennan wants to see you. Now. Claire's pulse quickened. About? He didn't say. But he looked serious. Tom and Claire exchanged a glance. She followed Priya to Brennan's office. He was standing behind his desk, arms crossed, tablet in hand. His expression was unreadable. Sit, he said. Claire sat. Brennan set the tablet down, facing her. On the screen was a military personnel file. Her file. Old photo. Rank insignia. Service record. Major Claire Watts. Brennan read aloud. U.S. Army Medical Corps. 7 years active duty. 3 deployments. Assigned to forward surgical team. Helmand Province. He looked up. Why did you lie to me? Claire's throat tightened. I didn't lie. You asked if I had military background. I said no. Technically, I don't anymore. That's semantics. That's the truth. Brennan leaned forward. You were court-martialed. Dishonorable discharge. That's not just leaving the service, Watts. That's being thrown out. I'm aware. So why the hell are you here? Claire met his eyes. Because I'm a good surgeon. You're a disgraced soldier. The words landed like a slap, but Claire's expression didn't change. I saved 11 lives that day. 11 soldiers who would have died if I'd followed evacuation orders. The Army decided that wasn't worth the protocol I broke. That's their judgment, not mine. Brennan stared at her. And the general in my recovery room, Marcus Hayworth? He's the one who signed your discharge papers. Yes. And you operated on him anyway? Yes. Why? Claire's hands tightened in her lap. Because he needed surgery, and I'm a surgeon. That's not an answer. It's the only answer I have. Brennan sat back, studying her. You should have recused yourself. That's basic ethics. I know. So why didn't you? Claire hesitated. The truth was complicated. The truth was that she'd spent 5 years wondering if she'd made the right choice that day in Helmand. If the lives she'd saved were worth the career she'd lost. If staying behind had been heroism or stubbornness. And now the man who'd condemned her was alive because of her. Maybe that was answer enough. Because someone had to, she said finally. Brennan shook his head. I don't know whether to fire you or promote you. I'd prefer neither. He almost smiled. You're a pain in my ass, Watts. I've been told. He picked up the tablet, scrolling through her file. It says here you performed over 800 combat surgeries, survival rate 93%. 3 commendations for surgical excellence under fire. He looked up, and they discharged you for insubordination. The protocol said evacuate. I stayed. Why? Because people were dying. Brennan set the tablet down. You know he's going to recognize you when he wakes up. Claire nodded. I know. What are you going to do? My job. That's not. It's all I can do. Brennan sighed. You're not making this easy. I'm not trying to. He waved toward the door. Get out, and stay away from Hayworth's room unless I authorize it. Understood? Understood. She stood and left. In the hallway, her hands were shaking again. She pressed them against her sides, breathing slowly. Tom was waiting near the elevator. How bad? He knows. Everything? Enough. Tom nodded. What now? Claire glanced back toward the recovery wing. Now I wait. For what? For Hayworth to wake up. She didn't say the rest. Didn't say that she was terrified of what would happen when he opened his eyes and saw her standing there. Didn't say that part of her wanted him to remember, wanted him to know that the woman he destroyed had just saved his life. And part of her wanted to disappear before he ever had the chance. Tom seemed to understand anyway. You can't avoid him forever, Doc. I know. So what's the plan? Claire pulled off her gloves, replaced them, and pressed the elevator button. I don't have one. The doors opened. She stepped inside, and as the elevator descended, she closed her eyes and tried to remember what it felt like to be someone other than the woman who carried her past and the scars on her hands. But the memory wouldn't come. It never did. The call came at 11:32 p.m. Claire was in the on-call room, staring at the ceiling, when her pager buzzed. Hayworth, crashing. She was on her feet before the second beep. The recovery room was chaos when she arrived. Monitors screaming, blood pressure dropping. Hayworth's face was gray, his breathing shallow and rapid. Brennan was already there, hands on Hayworth's abdomen. He's bleeding again. The repair failed. We need to get him back to the OR now. How long? Claire asked. 5 minutes to prep, maybe less. He doesn't have 5 minutes. Brennan shot her a look. Then what do you suggest? Claire stepped closer, assessing. Hayworth's abdomen was distended, rigid. Internal bleeding, fast and uncontrolled. The kind of bleed that killed in minutes if you didn't act immediately. We open him here, she said. Are you insane? This is a recovery room, not an OR. He'll be dead before we get him upstairs. Brennan hesitated. We don't have the equipment. We have enough. Claire turned to Tom. Get me a basic surgical kit. Scalpel, clamps, sutures, fast. Tom didn't question. He ran. Priya stood frozen. Dr. Watts, this is necessary. Claire pulled on a gown, her movements precise despite the adrenaline flooding her system. Dr. Brennan, I need you to assist. Dr. Chandran, manage the airway. Brennan stared at her. You're taking over? Unless you have a better plan. He didn't. Tom returned with the kit. Claire grabbed the scalpel, positioned herself over Hayworth's abdomen, and paused. This was it, the moment her two worlds collided completely. She looked down at her gloved hands, double-layered, always double-layered. But the repair she needed to do required precision beyond what the gloves allowed. The technique she'd invented in Helmand, the one that had saved 43 lives, required direct tactile feedback, skin to tissue. She couldn't do it with gloves on. Brennan saw her hesitation. Watts, if we're doing this, I know. She stripped off the outer gloves, then the inner ones. Her hands were bare. The scars were immediate, visible, unmistakable. Burned tissue stretched from her wrists halfway up her forearms. Keloid scarring, thick and ropey. Skin grafts in uneven patches. The kind of injuries that came from fire and metal and staying too long in a place that should have killed you. Priya gasped. Tom went still. Brennan stared. Jesus Christ. Claire didn't look at them. She focused on Hayworth. Scalpel, she said. Brennan handed it to her. Her scarred hands moved. The incision opened clean, following the original surgical line. Blood welled up immediately. Claire's fingers dove in, feeling for the source. No hesitation, no second guessing. Suction, she said. Tom moved in with the suction catheter, clearing the field. Claire's hands worked like they had muscle memory beyond conscious thought. Finding the bleeder, isolating the vessel. Her fingers moved through tissue with a precision that shouldn't have been possible given the scarring. How are you doing that? Priya whispered. Claire didn't answer. She clamped the vessel, tied it off, checked for additional bleeding. Her hands were steady. The scars didn't slow her down. If anything, they seemed to guide her, like the tissue remembered what the mind tried to forget. Brennan watched, transfixed. That technique, I've never seen anything like it. Battlefield resurrection, Claire said quietly. Developed it in Helmand. High-speed vascular control for penetrating trauma. She tied another suture. Saved 43 lives with it. And they court-martialed you anyway. Yes. She worked in silence for another 3 minutes. Tying off vessels. Packing the liver. Checking for leaks. Her scarred fingers moving through Hayworth's abdomen, like a pianist playing a familiar piece. Finally, she stepped back. He's stable. The monitors confirmed it. Blood pressure rising, heart rate normalizing. Brennan stared at her hands. Why didn't you tell me? Because it doesn't matter. Like hell it doesn't. Claire stripped off the surgical gown, reaching immediately for a fresh pair of gloves. But Brennan caught her wrist. Wait. She froze. He turned her hand over gently, studying the scars, the burn patterns, the grafts, the places where the skin had healed wrong and the surgeons had done their best to fix it. 40 minutes in a burning hospital, he said quietly. Yes, you could have died. Yes, but you stayed. Claire pulled her hand back, sliding the gloves on quickly. I did my job. No, Brennan's voice was firm. You did more than your job. Before she could respond, Hayworth's eyes fluttered open. Everyone froze. His gaze was unfocused at first, confused. Then it sharpened, moving around the room, landing on Brennan, on Priya, on Tom, then on Claire. He stared. His mouth moved. Try. To form words around the intubation tube. Tom moved to remove it carefully, and Hayworth coughed, gasping. Easy, Brennan said. You're in recovery. You had internal bleeding. We just… Major Watts, Hayworth rasped. The room went silent. Claire didn't move. Hayworth's eyes were locked on her. Major Claire Watts, Forward Surgical Team Charlie, Helmand Province. She swallowed. It's just Dr. Watts now. Your hands. His voice was weak but clear. I recognize those scars. You should, Claire said quietly. You're the reason I have them. Hayworth's face went pale. What? November 14th, 2019. Mortar attack on the field hospital. You ordered immediate evacuation. I stayed behind. She held up her gloved hands. 40 minutes. 11 patients saved. 16 members killed. Her voice didn't waver. You signed my court-martial 2 weeks later. Hayworth closed his eyes. Oh God. Brennan looked between them. Wait, you're the one who… Yes, Hayworth whispered. I signed the papers. Why? Claire's voice was steady, but something raw edged into it. Why did you condemn me for saving lives? Hayworth's breathing was labored. Because the report said you abandoned your post, said you panicked, said you disobeyed direct orders and put other lives at risk. He opened his eyes, and they were filled with something that looked like horror. I believed the report. The report was wrong. I know that now. Now? Claire stepped closer. You know now? After 5 years? I didn't have all the facts. You didn't ask for them. Hayworth flinched. You're right. I didn't. He looked at her hands again. I destroyed your career based on incomplete intelligence, and you just saved my life anyway. Claire didn't respond. The monitors beeped steadily in the silence. Finally, Hayworth spoke again, his voice breaking. Why? Because I'm a surgeon, Claire said, and you needed surgery. After what I did to you. After what you did to me, I could have let you die. She pulled her gloves tighter. But that would have made me the person you said I was. A coward who abandons people when it matters. Hayworth's eyes filled with tears. I'm sorry. Sorry doesn't give me back 5 years. I know. Claire turned to leave. Wait, Hayworth said. Please. She paused at the door, but didn't turn around. The report, Hayworth continued. It was falsified. I found out 3 years ago. Your commanding officer wanted you gone. He fabricated the intelligence, made it look like you'd endangered lives. His voice cracked. You were set up, Major, and I signed off on it without question. Claire's hands clenched inside the gloves. I've been trying to find you for 2 years, Hayworth said. To tell you the truth, to fix it. She turned slowly. Fix it? I can reopen your case, clear your record, restore your commission. I don't want my commission back. Then what do you want? Claire looked at him for a long moment. At the man who'd signed the papers that destroyed her. At the man whose life she'd just saved. Twice. I want to stop carrying this, she said quietly, and then she left. 3 days later, Claire stood in Brennan's office again. This time, she wasn't alone. Hayworth sat in a wheelchair beside the desk, still pale but recovering. Brennan stood behind his desk. Tom and Priya waited near the door, and a man in a dress uniform, Colonel James Ridge, 57, active duty liaison to the VA, stood with his arms crossed, holding a folder. Dr. Watts, Ridge said. Thank you for coming. Claire's hands were in her pockets, gloves on as always. I was told this was mandatory. It is. Ridge opened the folder. I've spent the last 72 hours reviewing your military service record, the original court-martial documentation, and the subsequent investigation that General Hayworth initiated 3 years ago. Claire's jaw tightened. I'm aware of my record. Then you're aware that your commanding officer, Lieutenant Colonel David Marsh, falsified the incident report from November 14, 2019. She nodded slowly. Ridge continued. Marsh claimed you abandoned your post during the mortar attack, that you evacuated prematurely and left patients to die. He submitted testimony from 2 witnesses who later recanted, saying they were pressured to lie. I know. What you don't know, Ridge said, is that Marsh had a history of targeting female officers under his command. You were the third surgeon he tried to remove. The first two accepted transfers rather than fight. You didn't. Claire's voice was quiet. He wanted me gone. He wanted you discredited, Hayworth said from the wheelchair. His voice was stronger now, but weighted with guilt. And I gave him the tool to do it. I signed those papers without verifying the facts, without interviewing you directly. I trusted the chain of command, and the chain of command was corrupt. Brennan leaned forward. Why are we here, airing this now? Because General Hayworth formally requested a review of Major Watt's case 2 years ago, Ridge said. The investigation concluded 6 months ago. It found that the court-martial was based on fraudulent evidence and should be overturned. Claire's breath caught. Overturned? Completely. Ridge pulled out another document. As of 48 hours ago, your dishonorable discharge has been voided. Your record has been cleared. And you've been reinstated to the rank of major with full back pay and benefits. The room went silent. Claire stared at the paper. I don't understand. You were right, Ridge said simply. The Army was wrong, and we're correcting it. Priya's eyes were wide. That's incredible. Tom nodded, arms still crossed, but his expression had softened. Brennan looked at Claire. Did you know about this? No. Her voice was barely a whisper. Hayworth shifted in his wheelchair. I wanted to tell you sooner, but the process took time. Legal reviews, witness depositions. Marsh fought it every step of the way. Where is he now? Claire asked. Retired. Under investigation for multiple violations of the Uniform Code of Military Justice. Hayworth's face was grim. He won't wear the uniform again. Claire's hands tightened in her pockets. 5 years. 5 years of carrying the weight of a dishonorable discharge, of rebuilding her credentials from nothing, of hiding who she was because the truth was too painful to speak. And now they were saying it had all been a lie. I don't know what to say, she said finally. You don't have to say anything, Ridge replied. But there's more. He pulled out a third document. The Army Medical Corps is offering you a position. Full bird colonel. Head of trauma surgery at Walter Reed National Military Medical Center. You'd be developing curriculum for forward surgical teams, training the next generation of combat surgeons. Claire's pulse quickened. Walter Reed. Top facility in the military medical system. Full autonomy. Your choice of staff. Ridge paused. You'd also have the opportunity to implement the techniques you developed in Helmand. The battlefield resurrection protocol saved lives, Major. The Army wants to make it standard training. Priya looked at Claire. That's an incredible offer. It is, Claire said quietly. But she didn't sound convinced. Brennan noticed. You're hesitating. Claire pulled her hands from her pockets, looking down at the gloves. I spent 5 years learning to be a civilian surgeon, learning to work without the rank, without the uniform, without the weight of combat medicine. And now you can go back, Ridge said. Can I? The question hung in the air. Hayworth spoke, his voice careful. Major, I know what I took from you, and I know an apology doesn't come close to making it right. But this offer, it's a chance to reclaim what Marsh stole, to be who you were always meant to be. Claire met his eyes. And who is that? A surgeon who saves lives when everyone else gives up. She looked away, her throat tight. Brennan cleared his throat. For what it's worth, Watts, you've been one of the best trauma surgeons I've ever worked with. And I don't say that lightly. He paused. But if you take that offer, you'll be leaving a gap here that won't be easy to fill. You'll manage. That's not the point. Claire smiled faintly. You told me 3 days ago I was a pain in your ass. You are, but you're a competent pain in my ass. Brennan's expression softened. And this place is better because you're here. Tom stepped forward. Whatever you decide, Doc, you've earned it. All of it. Priya nodded. You deserve this. Claire looked at each of them, then back at Ridge and Hayworth. Can I have time to think about it? She asked. Ridge nodded. You have 2 weeks. After that, the offer expires. Understood. Ridge closed the folder and extended his hand. It's an honor, Major Watts. Claire shook it, her gloved hand firm in his grip. Hayworth wheeled closer. I know I don't have the right to ask. But whatever you decide, I hope you'll let me help. I owe you that much." Claire studied him for a long moment. The man who destroyed her career. The man whose life she'd saved. The man who'd spent 2 years trying to undo the damage he'd caused. "You don't owe me anything," she said quietly. "But if you want to help, there's something you can do. Anything. There are others like me, soldiers who were wrongfully discharged, who lost everything because someone in the chain of command decided they didn't belong." Her voice was steady now, stronger. "Help them. Use your rank, your influence. Make sure what happened to me doesn't happen to anyone else." Hayworth's eyes filled with something that looked like relief. "I will. I promise." Claire nodded and turned to leave. Brennan called after her. "Watts." She paused. "Whatever you decide," he said, "you've got a plow." "Ace here, always." She didn't respond, but something in her expression softened. Then she left. In the hallway, she pulled off her gloves and stared at her hands. The scars were still there. The burn tissue, the grafts, the reminder of 40 minutes in a burning hospital. But for the first time in 5 years, they didn't feel like a brand of shame. They felt like proof. Proof that she'd stayed when others ran. Proof that she'd saved lives when the system said to abandon them. Proof that her competence transcended the uniform, the rank, the title. She pulled on a fresh pair of gloves and walked toward the trauma bay. There was work to do. And for now, that was enough. 6 months later, the conference room at the VA Medical Center was packed. Residents lined the walls. Attending physicians filled the chairs. Nurses stood in the back, arms crossed, watching. At the front, Claire stood beside a projection screen showing anatomical diagrams. She wore scrubs. Her hair pulled back, gloves on her hands. But something about her posture had changed. She stood taller now, steadier. "Battlefield Resurrection Protocol," she said, advancing the slide, "is based on 3 principles: speed, precision, and adaptability. In forward surgical environments, you don't have the luxury of imaging, specialized equipment, or backup. You have your hands, your training, and the will to keep fighting when everything says to stop." She clicked to the next slide, a diagram of the technique she'd used to save Hayworth. Step-by-step vascular control for penetrating abdominal trauma. "This approach reduced mortality rates in my unit by 18%, Claire continued. 11 soldiers survived injuries that should have killed them, not because of technology, because of technique." A hand went up in the back. A young resident, maybe 27. "Dr. Watts, how do you maintain that level of precision under fire? The stress alone." "You train until the stress becomes irrelevant," Claire said. "You practice the motions until your hands remember them better than your mind does. And you trust that when the moment comes, your body will do what it's been trained to do." Another hand, Priya, sitting in the front row. "What about emotional management? Operating on someone you know, or in conditions where you're personally at risk?" Claire's expression didn't change, but her hands shifted slightly. "You compartmentalize. You separate the person from the patient, the fear from the task." She paused. "It's not easy, but it's necessary." Brennan sat in the corner, arms crossed, watching her with something that looked like pride. Beside him, Sarah Voss leaned over. "She's good at this." "She's good at everything," Brennan muttered. "It's irritating." Sarah smiled. Claire took questions for another 20 minutes, then dismissed the group. Residents filed out, talking in low voices about the techniques, about the slides, about the surgeon who'd somehow done the impossible and come out the other side. Tom approached as the room cleared. "Hell of a presentation, Doc." "Thanks." "You decide yet?" Claire knew what he meant. Walter Reed. The offer was still on the table. Ridge had extended the deadline twice, saying the Army could wait for the right person. "Not yet," she said. "Clock's ticking." "I know." He nodded and left. Claire gathered her materials, packing the laptop into her bag. When she looked up, Hayworth was standing in the doorway. He walked without the wheelchair now. Still careful, still recovering, but upright, alive. "That was impressive," he said. "Thank you. I meant what I said 6 months ago. If you ever want to come back, there's a place for you." Claire closed her laptop. "I appreciate that. But you're not interested." She met his eyes. "I didn't say that." Hayworth stepped closer. "Then what are you saying?" Claire pulled off her gloves, setting them on the table. For the first time in years, she let someone see her hands without immediately covering them again. The scars was still there, still visible, but they didn't define her anymore. "I'm saying I don't know if I want to go back to being Major Watts," she said quietly. "I spent 5 years learning to be someone else, someone who didn't carry the weight of rank and protocol and expectations." She looked down at her hands. Someone who just did the work because it mattered. "You can still do that as a colonel." "Can I?" Hayworth considered. "No, probably not." He paused. "But you could do something else." "What?" "Stay here. Build the program you want to build. Train civilians and veterans together. Show them that trauma surgery isn't about rank, it's about competence." He gestured toward the now empty room. "You're already doing it. Make it official." Claire frowned. "The VA doesn't have funding for. I've been talking to some people." Hayworth pulled a folded paper from his jacket. "Department of Defense is interested in a pilot program, civilian military trauma training partnership. You'd run it, full autonomy, your curriculum, your rules." He handed her the paper. Claire unfolded it slowly. The letterhead was official. Department of Defense, Office of Medical Readiness. The proposal outlined a 3-year program, fully funded, designed to integrate military trauma protocols into civilian emergency medicine. Her name was listed as program director. "You did this," she said. "I owed you." "You don't." "Yes, I do." Hayworth's voice was firm. "I can't give you back 5 years, but I can give you the chance to make sure those 5 years meant something." Claire stared at the paper, at the possibility it represented. Not going back to who she was, not pretending the past didn't happen, but moving forward with it, using it, teaching the next generation that sometimes the right thing means breaking the rules. "I need to think about it," she said. "Take your time." Hayworth turned to leave, then paused. "For what it's worth, Major, Dr. Watts, you're exactly the kind of surgeon the system needs. The kind who doesn't give up, even when giving up would be easier." He left. Claire stood alone in the conference room, holding the proposal, her scarred hands trembling slightly. She pulled on her gloves, slowly this time, deliberately, and walked into the hallway. Brennan was waiting. "You're going to say yes." "I haven't decided." "Bullshit. You decided the moment he handed you that paper." Claire smiled faintly. "Maybe." "Good." Brennan started walking and she fell into step beside him. "Because if you'd taken the Walter Reed position, I'd have had to find someone else to handle the impossible cases. And frankly, I'm too old to train someone new." "You're 52. "Exactly. Ancient." They reached the trauma bay. The usual chaos surrounded them. Monitors beeping, nurses calling out orders, an ambulance pulling up outside, lights flashing. "Incoming," Tom called. "Motorcycle accident. Male. Early 20s. Possible internal bleeding." Claire moved without thinking, pulling on a gown, checking the monitors, her hands already reaching for instruments. Brennan watched her for a moment, then smiled. "Yeah," he muttered. "You're exactly where you're supposed to be." 3 months later, the program launched. 20 participants, half military, half civilian. Doctors, nurses, paramedics, all learning the techniques Claire had developed in the field, all training under the surgeon who refused to give up when the system told her she was done. Claire stood at the front of the simulation lab, demonstrating the incision pattern for rapid vascular access. Her hands moved with the same precision they always had, scarred but steady, gloved but unashamed. "Remember," she said, "in trauma surgery, hesitation kills. Trust your training, trust your hands. And when the protocol says to stop, ask yourself, is the protocol saving lives, or is it just covering liability?" A young Army medic in the back raised his hand. "What if we get in trouble for breaking protocol?" Claire smiled. "Then you're in good company." The room laughed. She continued the demonstration, walking them through each step, answering questions, correcting technique. When the session ended, several participants stayed behind to ask more questions, to share stories, to thank her. One of them, a former Marine, 31, missing his left leg below the knee, waited until the others had left. "Dr. Watts?" She looked up. "Yes? I just wanted to say thank you for this program, for showing us that a discharge doesn't mean we're done." He gestured to his prosthetic. "I thought losing my leg meant losing my career, but you're proof that we can rebuild." That we're more than what the system says we are. Claire's throat tightened. What's your name? Marcus. Marcus Chen. She shook his hand. It's good to meet you, Marcus. You too, ma'am. He left. Claire stood alone in the lab, looking at the training mannequins, the equipment, the diagrams on the walls. The space she'd built, the program she'd created. Her phone buzzed. A text from Hayworth. Saw the quarterly report. 97% satisfaction rate. Participants requesting program expansion. Well done, Major. She smiled and typed back. It's Dr. Watts, and thank you. Another buzz. This time from Tom. Drinks tonight? You're buying. You're fancy now. She laughed. Fine, but only if you stop calling me fancy. She pocketed the phone, pulled off her gloves, and looked at her hands one more time. The scars were still there. They always would be. But now, when she saw them, she didn't see shame. She saw proof. Proof that she'd survived. Proof that she'd rebuilt. Proof that sometimes the hardest thing and the right thing are the same thing. She pulled on a fresh pair of gloves and headed toward the door. There was still work to do, and she was exactly where she was meant to be.